Welcome to Africa to You. I'm Vivian Birchall, your host. Today's episode, we are hosting Dr. Lydia Asana, who is the coordinator for the Harvard Medical School's Global Health Catalyst Summit, and Dr. Baskim Ziberi, who is a Fulbright visiting scholar with the Department of Radiation Oncology, Division of Medical Physics and Biophysics at Harvard Medical School. He's also on the 2019 Harvard Global Health Catalyst Abstract Committee. His home institution, though, he's an associate professor with the physics department at the University of Tetova in Macedonia. We're going to talk about the Global Health Catalyst Summit. Previously, I hosted the coordinator of this event, but today we have these two guests to tell us more about the Global Health Catalyst Summit. Welcome to our show.
Thank you so much.
Thank you very much.
So, I recently hosted your colleague, Oscar Nebangwa, who gave an overview of the Global Health Catalyst Summit, including the Leadership Academy. Why is it important for the people to attend this summit, and what is this summit?
Okay. Well, first of all, thank you again for having us. We're very happy to be here. The Harvard Global Health Catalyst Summit is an annual event. It's part of the Global Health Catalyst program at Harvard Medical School. It is our premier educational event, and we do this once a year. It's an opportunity for people of diverse backgrounds to come and engage in collaborative opportunities in global health around the world. There are four main areas in which we work. We work primarily with non-communicable diseases, focusing on cancer and related diseases. And we work in the areas of education, care, research, and advocacy. So you had asked why people should attend. Cancer and non-communicable diseases in general affect all of us in one way or another. And we strongly believe that everyone has an opportunity to be involved. And so this is a place where we can bring together our various resources and experiences for the benefit of others, and also to strengthen our own ability to contribute to this. Main reasons why we would encourage people to attend, as you asked, are first of all, education and exposure. It's a great opportunity to learn from leaders in the field, in research, in care, in advocacy, and in education, healthcare around the world. It's also a great opportunity to be exposed to new research, to opportunities for collaboration, and also for those who are attending to share their insights, in a way giving others an opportunity to be exposed to their participation as well. It's a great place for opportunities, for collaboration. We are really big on the fact that if we pool our resources, we can have greater impact and have that impact be sustainable.
Right.
So when we offer opportunities for initiating as well as strengthening collaborations across disciplines.
Right.
And there's also opportunity for some entertainment and great networking also.
Yeah, I'll get back to you on the collaboration point, but Mr. Baskim, what does the Abstract Committee do?
Yeah, the Abstract Committee, in fact, collects the submission of the abstracts from around the world, from different groups, and then we do the selection of the abstracts. Because we have a huge number of abstracts, we have to divide them according to the sessions.
All right.
So, and this year we had also the possibility, we gave the possibility to participants to simply submit abstracts freely, because usually before we worked mostly with invited people, stakeholders, and researchers and people that are involved in non-governmental organizations that are very active in the field concerning awareness and cancer care in different countries in the world.
Awesome. This is an interesting program. And getting back to you about the collaborations, from the little I have been reading about you, there are some low-cost technologies that you guys have come out of this process, the Global Health Catalyst.
Yes.
And what are some of these low-cost technologies and approaches for global health that have been developed through this initiative? I'm specifically intrigued by the drone technology targeting cancer.
Okay. I will let Dr. Ziberi talk about that because he is a physicist, but we believe that low-cost technologies increase the opportunity for access to care and increase the opportunities for experts to collaborate in ways that they can treat patients. And so we want to highlight some of these low-cost ways that would increase the number of people who have access to care. Dr. Ziberi, please tell us more about the tiny drones.
Yeah, one of maybe one also possibility or one use of the local knowledge and know-how and expertise also, for example, is a cloud system where we are let's say, given the possibility to countries that don't have the experience, the resources, for example, for deciding and for helping them to interpret a lot of results, so we can communicate online with those and use the experts here, because the idea is to make the brain drain into healthcare gain for low and middle income countries. Now the tiny drones is a very attractive name as such. The idea is in fact to bring the therapy in a targeted way directly to the tumor sites. This is the main idea, because the biggest obstacle now what we have with radiotherapy, chemotherapy is that we also destroy a lot of healthy cells. So the idea with the tiny drones is we can bring a bunch of processes directly on the tumor sites, for example, like the emission of the electrons to the nanoparticles, or the targeted delivery of the therapeutic drugs directly on the tumor sites without having side effects. And I think with the tiny drones is that we can control the amount of material or of the payloads that we deliver during the time. So it depending on the type of the disease and how intense is, for example, the cancer and all this. So we can control the process not only of delivering and localized treatment and radiation, but also of the amount over time.
Right, and I watched a brief video of the drone technology, and they're really tiny.
They're nanoparticles, yes.
Yeah. How do they get to the affected cancer cells? How do they know that this is the cell that is affected? I'm just curious, as someone, of course, who is not a medical professional.
Yeah, it's in fact, so for the broader audience, it's like putting something in these tiny drones that can interact only with particular cells in the body. That is the main idea. So, for example, we can load these tiny drones with a particular type of ligands that goes directly, that likes mostly to communicate only with cancer cells. So it goes directly to the cancer sites, and so it's kind of targeted journey of the tiny drones until they arrive to the cancer site.
Oh, that gives me a bit of explanation.
And something developed by a local scientist here in our area, so we're very excited about that.
Yeah, and what are the known side effects, if any? Just curious.
Well, currently research is being done with small animals, with mice in the lab, and we have not recorded any side effects, which makes it very exciting. We are working with partners who study pain and who are specialized in studying pain expressions in mice, and we have not been able to see that they are stressed as a result of this therapy. So that is really exciting, and we're looking forward to clinical trials beginning this year.
Oh my goodness, please update me, and so we can update our viewers on what is happening.
Technology is really so far developed that at the end of the year we are passing to clinical trials.
Awesome. I hope I'll host you again to talk about those clinical trials.
Sure.
Just as a
Pleasure,
follow-up. And how does the Global Health Catalyst cooperate with Cures Within Reach, speaking of collaborations, and with government leaders?
Okay, so Cures Within Reach is a Chicago-based nonprofit organization, and it's a great example of how we seek out and also encourage others to seek us out for collaborations. So they actually initiated this relationship that we're thrilled about. Cures Within Reach is focused on funding alternative uses of existing therapies. So they are a repurposing organization. And what they do is they encourage researchers to find therapies that are already approved for use in one indication that show promise for help in another indication. That way, the time from research to application is shortened, and the cost for that research is also shortened because certain parts of it have already been approved. So on the 23rd of May, so the day before our full summit begins, we are collaborating with Cures Within Reach for a pre-summit event where finalists of their program will pitch publicly their research projects. This year we were particularly keen to participate because all the research that's being pitched here in Cambridge on the 23rd of May will benefit low and middle income countries. So they are specifically for diseases that disproportionately affect low and middle income countries. So we're inviting the community to come out, hear these pitches live, and actually have the opportunity to cast their vote for which of these finalists, which of these great projects will get up to $50,000 worth of funding to move their research forward.
That is exciting, and it ties into the next question I was going to ask Dr. Ziberi. What can you tell us about applying the developed experience of Global Health Catalyst Summit to the low and middle income countries in Southeast Europe?
Exactly, that's also one of the points that we are working together. The idea is to, in fact, to not concentrate, for example, this global health initiative only to particular countries, but to all countries in the world that have similar problems and difficulties of accessing cancer care.
Right.
And the low and middle income countries in Southeast Europe have similar difficulties, problems of accessing this effective care, health care, similar to other low and middle income countries in the world. Therefore, we are trying now this expertise and this experience also to transfer it in the Southeast European countries that have need for such initiatives and have also better access to the cancer care.
Yeah, that's what attracts me to this whole Global Health Catalyst, because it's targeting, healthcare is a global concern, and the different communities in the world struggle with healthcare. So it's good to see the collaborations being made, not just with Africa, but with any emerging and struggling economy.
And therefore, maybe it's good to mention that we will have for the first time also stakeholders from countries like Macedonia and Kosovo taking part in the Global Health Summit this year.
Bangladesh.
Yeah, which was actually going to be my next question for you to tell us about the diverse speakers this year.
Number of speakers and also the expertise of the speakers range from government, from politicians, from stakeholders in the politics, from in the research institutions, to the researchers itself, up to the people that are really active in the field itself, working with the people, with the communities there. So there is a broad spectrum of professionals taking part in the summit.
I'm with Africans in Boston, and I'm also a member of the African diaspora, and we're always finding ways to try to collaborate with processes that help motherland.
Right.
So how can the diaspora engage with these processes?
Okay, so this is actually something that is very near and dear to my heart. This is my area of research is in public policy and administration, and my focus was on the engagement of the African diaspora in particular, but has applications for any diaspora population.
Right.
In recent years, literature shows and recognizes the role, the potential that diaspora have to contribute to development in their sending countries. So that's less and less disputed. However, stakeholders in the areas where we seek to participate don't necessarily know how to engage us, don't necessarily know the extent to which diaspora can participate and actually move things forward, make impact lasting. Because in many ways, diaspora are gatekeepers in their sending communities, or know the gatekeepers. You know, if you were to go to my home country and you wanted to go to the village from which I come, if you don't pass through our traditional head, you may not be successful.
Right.
And so you may need me to call my uncle who knows the chief who can take you to the farm. You know, these things are really significant.
That's
because
Africa.
Once the community has buy-in from their leader, you can come in with those therapies, you can come in with that education and have the receptiveness and the involvement that will make those efforts sustainable. So diaspora have a big part to play in coming to be aware of the things that we're trying to do, coming to share the needs that you're aware of in your community, and then collaborating with those who are there. So let me, for example, give a cycle that would be an example. This year, we are really excited that, for example, the Ugandan community in the Boston area, they have found out about what we're doing, and they decided, you know what, we want to be represented because we haven't been there in the past. We've had representation from a good number of countries, Cameroon, Nigeria, Rwanda, Tanzania. We've had from Latin America. We've had from a good number of countries, just so many. And so this year, the Ugandans actually were proactive in saying, not only do we want to participate, we would like to have our ambassador participate because we know that that will carry weight. So for the first time, we will have the ambassador of Uganda present. We have several countries that will have first-time ambassadors, Mali, Mozambique, we're expecting Jamaica, we're expecting. And so to have their government represented to come and hear what other countries have already benefited, to come and share where they are in terms of global health and cancer care and access to care and technologies that they may need, to have Ugandans, to have Nigerians, to have Rwandans come and say, you know what, I'm actually a professional in this area. I want to contribute. Or I know somebody who at home could be help with getting to those gatekeepers. But hearing those conversations around the table, right, would make a difference. We can't know your particular need. We can't know the resources you can bring if you are not represented. Now, if we hear the needs from the sending countries and we hear the potential from the diaspora, and we say, you know what, one of the big things is, for example, large equipment. It's expensive, you need training to be able to use it, and then transporting it is also an issue. So what we could do is that we have stakeholders who are industry leaders. We work with several companies, Varian, Best Medical, Electa, PTW. So some of these stakeholders come to share about their technologies. They come to hear about maybe the challenges we have in terms of consistency of power, and so we may need to consider solar. But those are contextual things that you will hear from those on the ground. So now if we go to one of these companies and say, you know what, this community, which would be the majority in Africa, for example, they do not have this type of equipment that we need. Is there a way that you can work with us to provide it at a lower cost? The company may say, yes, we're willing to do that, but how do we get it in country? We need the government leaders to be aware that we're trying to do this because there's customs to clear, you know, people need to get trained. Maybe we have human resources that we're sending to that nation. They need visas, they need, you know, orientation in the country. So the government leaders, when they're aware, can bring some resources in that area. If we're able to link in with existing health systems in a nation, that also helps our reach to be wider, our impact to be greater, and to be more sustainable if this becomes a national thing. So in that way, we've got the diaspora, we've got the ministers coming from the home countries, we've got the industry leaders that are giving input, we've got the government leaders that are giving input, and we've got nonprofit organizations are really good about the local communities where they work, getting them engaged so that especially things like the education, you know, you need those relationships in the community. So these are some ways in which we see it as everyone has a part to play in order for it to be successful.
Right. Well, I was beaming with pride when you mentioned Uganda because I know I'm an immigrant from Uganda.
This year we are we're excited.
I am so proud of my fellow Ugandans. You're doing a great job.
Yes, absolutely.
But again, you know, there's something you mentioned about the concerns, you know, back in Africa, which is the energy and electrification. You know, it affects the service provision, because if we're talking about cloud systems, if we're talking about, there has to be consistent electricity. So do you partner with the energy sector?
Right, to support the efforts that we're bringing to these nations. So these are the kinds of reasons why we need you, and we need others to come and say, you've got that all figured out, but what about the power supply, right? So one way that we've started working in that is we've had a guest last year, and he's coming again, who is working on solar-powered radiation therapy centers.
Excellent.
And they are already testing one, I believe it's in Rwanda. So that is something that we've got the sunshine, you know, this is something that could work for us. But again, bringing the government leaders to say, you know what, it's not just about the healthcare professionals and equipment, it's also about power. So can you introduce us? Can you give us that entryway to the energy systems in your government so that we can work with them? Because we've got expertise in these countries, we've got expertise outside of these countries, and it's a matter of bringing them together.
That's a good way of doing it, and of going forward with any collaborations, because it's a whole ecosystem.
It is. It absolutely
it tackles all the infrastructure in itself.
So there has to be an infrastructure to support all these programs to be sustainable, and especially in emerging economies. You know, the sustainability part is the one that is usually the hardest. Yes, it's easy to come up with these new programs, but how sustainable are they? And then, of course, how are you building local capacities to make sure that once the head of this program, for example, is not there anymore, there's local capacities in those countries you're collaborating with. And it's something that I would be really interested in saying or hearing about. I don't know whether you can say anything.
Exactly. Therefore, one of the main goals is, in fact, also education and training of people on site. That's,
yes. And we also, in terms of that, we have teams that go to countries. Once we have built some relationships, we've had teams go to Cameroon, to Nigeria, to Rwanda, to Tanzania, to go and, for example, survey their cancer facilities, to survey potential facilities and see if the bunker is being built correctly, to go and train those on the ground in the use of equipment that's there. Next week, we are really excited. We'll have our first Global Health Catalyst Summit on the African continent.
In Tanzania.
In Tanzania. So we've got a team getting ready to leave this weekend, and part of that will be the conference itself and all that entails. But in the afternoons, teams will be going out to Ocean Road Cancer Center to see how they can support training and how they can do some troubleshooting and things like that. But one that we have ongoing that I'd really like to mention is our online educational platform. So we have sponsored healthcare professionals in institutions where we have partnerships to have training in different parts of the world. We have a relationship with an institution in the Netherlands, and they are training some. We have relationship with the University of Heidelberg in Germany, and they are taking some. Harvard Medical Institutions are also taking some professionals who are coming. But we also have an online platform. This is the second year where we're doing it, and it's actually won an AAPM, American Association of Physicists in Medicine.
Physical medicine.
Yes. So last year, our director won an award for innovative education because of this platform. So in the first year, we had a pilot run with, I think, 10 or so participants in just using cloud and online resources to provide education. And we're able to pull expertise. So I think sometimes when we think about serving, we think of those with the needs that we're going to serve. But we also have experts who have the need and the desire to share their expertise. But they don't have the time necessarily. They may even have the funds to fly out and do a conference, but they don't have 2 weeks, you know. But now we're able to pull resources from Harvard Medical Institutions, from UPenn, from University of Heidelberg, from South Africa, who get on this online platform. They may have once a week, 30 minutes or an hour, and provide a course online. And then we have healthcare professionals from all over the world. We focus particularly in low and middle income countries who call in, participate in these live sessions that are interactive, and they can go through a program that we've already established that will earn a certificate at the end of the day. So in this way, we're able to train multiple persons at no cost to them. And that is one thing that we're focused on this year. So this year,
That's
we
amazing.
have over 100, I think about 140 participating in classes, and some of them will get their certificates at the summit this year.
And what's the criteria for participating?
Initially, this is our second year, so it's initially interest, but because of the nature of some of the courses could be for almost anyone interested. We have things like grants and fundraising, and we also have proposal writing and things like that. Some of them are more technical in medical physics or in radiotherapy or use of the equipment. So that would be a factor. For the certificate course, it's geared towards medical professionals, but there are courses for those who are just interested in gaining knowledge as well.
Yeah.
The idea is, in fact, to in the future to offer a broader spectrum of courses, depending on the needs, but also on particular groups all around low and middle income countries.
Oh, okay. So you can customize the training sometimes?
Yes, because we have experts in all fields.
All right.
So as the program grows, we will also be able to hear more the needs, the areas where training is needed, and respond accordingly.
Yeah, you know, using using Harvard Medical School and the surrounding here institutions and medical centers, all that, as a hoop, you have a large number of experts that you can use for this type of specialized training also, yeah.
Absolutely.
This is all amazing. And of course, when I was reading through some of the outcomes, there was one of for the previous meetings, you had what you called telemedicine and tumor boards. And that's one of the last questions I'll ask. What are these?
We have so much. So the tumor boards, currently we have 2 teams that are working. We have a team at MGH, so Massachusetts General Hospital, works with a team in Botswana. And once a month, you have experts on this end. You have a room full of various experts and residents sitting in a room on this side, and you've got the doctors in Botswana. They save their most challenging cases that they are just looking for a second opinion or for some direction in terms of a treatment plan. And we're able to use technology for both sides to view images of the tumor, of the site, patient, what's relevant, and talk through a treatment plan together. So that's what the tumor boards are. They're able to view those tumors simultaneously and have this conversation to be able to chart the way forward for those patients, particularly for challenging situations. We also have a team in Germany, a team of doctors, a part of Camphomedics. They are also doing something similar with Bingo Baptist Hospital in Cameroon. So we're looking to scale that up because currently it happens once a month, but we have seen more interest and there's definitely the need. So we're looking forward to scaling up the frequency and amount of cases that we can address through tumor boards.
That is excellent.
That is.
Who funds it?
So again, this is the beauty of collaborations and having a network.
Right.
It is, these experts are willing to share their expertise. The doctors on the ground have the need. We have the network. We have these collaborations that we have built. And so we are pulling together resources for the benefit of those who just do not have access. And so it's a joint effort, yes.
There's so much to take in.
There
I'm not
is.
going to try to exhaust everything in this session. We'll have a different session. But before we close, Dr. Ziberi, is there anything else you wanted to add?
Yeah, that's, in fact, for me, it's the first year I'm getting involved in the Global Health Catalyst here at Harvard, and it's really a pleasure and I'm looking forward really to use this experience to broaden also in the Southeast European countries. And my appeal is to all those that can contribute. Please come to the Global Health Catalyst Summit and see how can you contribute and help in and leveling these disparities in cancer care so that everyone can have access to an effective care system.
Excellent. And Dr. Asana?
I'd like to echo Dr. Ziberi's statement. We would really encourage all to come. It's hard to describe what this summit is. It is so diverse, it is so inspirational, it is so educational, and the opportunities, we have stories of even young people who are involved through volunteering, hearing something, finding a mentor, changing a major when they realize the impact that they can have either in their sending countries or in their local communities. But there's a part for everyone to play, and you really cannot know that part until you come and hear how others are already involved. So we would invite you all to Harvard Medical School. It is May 23rd is our pre-conference with Cures Within Reach, and then May 24th, it's a Friday, through the 27th, a Sunday. We have multiple sessions. Some are interactive, some are plenaries, and there's a lot more information on our website, globalhealthcatalystsummit.org.
Thank you all for being in Africa, my guests in Africa to you.
Absolutely.
And to our viewers, if you want to know more about Africa, African diaspora, and anything Afrocentric, just visit us at africatoyou.org and send me an email at africatoyou.vivian@gmail.com. Thank you for watching Africa to You. Till next time.
Thank you.